It's a common childhood illness, but this year, health officials say they're seeing much more of it. Thank you for joining us for 7 News at 5. I'm Alex Tabler.
And I'm Stephen Moore. Reporter Zach Coleman shows us what's causing the increase in the state and what families should watch out for.
Started as a few scattered cases in early September, it has now become a statewide concern. Cases of hand, foot, and mouth disease are spreading quickly across the state of West Virginia. The Ohio County Health Department says outbreaks are being reported in daycares, elementary, middle, and even high schools across the state. Health experts say there have been 18 outbreaks just since the start of September.
Outbreaks, 3 or more cases. We have onesies and twosies here or there, but when you get 3 cases within a facility, you have an outbreak, and you need to take some additional precautions within that facility when you have an outbreak.
The disease is most common in younger children, and it spreads easily through coughing, sneezing, or even sharing toys. Gamble says simple habits are part of the reason it spreads so quickly.
First and foremost is kids don't often wash their hands, and we're sharing so many things in daycares. We're on the floor, we're coughing, we're sneezing, and putting things in their mouth, and so we're going to share those viruses, and in this case we're going to share that virus.
While the illness can be very discomforting, it's typically mild and only lasting about a week. Parents are being urged to watch for early signs of infection.
For the most part, parents need to watch out for some telltale signs. One, the child's going to develop a fever and be very cranky, going to have some runny noses, cough. But then within a few days of that fever, you're going to look for those telltale rash signs, either within the mouth, look like blisters, or on your hand and feet, you're going to have little small blotchy blisters appear. And it's a pretty telltale sign of hand, foot, and mouth.
The health department also stated that the key to slowing the spread is keeping sick children home or until they're fever-free and continuing to practice good hygiene.
Number one, whether it's hand, foot, and mouth or any other respiratory disease, if you have a fever, stay away. So if that fever has broke, you don't need medication to reduce the fever, you can go back to school, daycare, etc. 2, if in regards to hand, foot, and mouth, as long as the blisters are not leaking, or the child is not uncontrollably drooling, such as a young child in a daycare, you can't control the drool. That's just what kids at that age will do. Kids can go back to daycare and school.
As cases continue to rise, health officials hope that a little bit of extra warning can go a long way. Reporting from Wheeling, I'm Zach Coleman, 7 News, working for you.
Thank you, Zach. Health officials state that if you see any signs or symptoms in your child, please consult with your doctor.